So, how can I, be kind to myself? How can I support myself? What does that support look like? Where could I find it? Those types of conversations that I'm hoping that, as we progressively move at having more of these conversations, that the younger generation will be able to have a bit of that representation.
And I think you're right. I think the younger generation, they are having those conversations a little bit more. And I'm so grateful for that when I see that happening.
Yeah.
And so we touched on a little bit non-BIPOC therapists. And if someone is out there and they're like, you know what, I do want to be able to support Black Canadians, how can they do so with even more cultural sensitivity in their own client care?
I think first and foremost is identifying that you need to do this work. I think that's the first hurdle, right? There's a lot of people, especially within the Canadian context, color blindness is a big thing in Canada, right? We don't see color. But for you not to see color specifically in your clients is for you to deny a significant part of their identity because they operate in a world that does see color. We operate in social systems that does see color and judges upon that color. And oftentimes disadvantages and marginalizes people based on that color. And those are the types of things that individuals may be showing up in the space and that may be the root of a lot of what they are facing. That may be the root of maybe some of the trauma they face or the depression or the anxiety that they're having, just to name a few. And so, I think it's important, if you are a non-BIPOC therapist, and I would even equally say as a BIPOC therapist, I think as a Black Canadian. I grew up here. My family is from the West Indies. However, my whole sense of self is Canadian. And so at times I felt quite disconnected from this idea of even, racism. To me, it was almost as if maybe it didn't really exist, right? And it wasn't until I was in the workforce, and that was my experience because of my upbringing and just kind of my different social contexts as I grew up, I never really had much encounters with overt forms of racism until I entered the workforce. And so I think it's important for even BIPOC therapists to recognize that we need to do our own work on what it means to be Black, and non-BIPOC therapists need to do their own work on what it means to have their racial identities. But then from there, you have to be committed to doing that work too, right? So whether it is some trainings that you may need to do, reading books, having, those tough conversations, and sometimes those tough conversations may be with other professionals who are from, these different racial groups. And some of those tough conversations may have to be with your client as you work through things and you are honest and upfront about what you understand and what you don't understand, and being willing to be challenged a little bit on your beliefs. And I think, at the end of the day, the hope is that, we will have, non-BIPOC therapists who are willing to be activists and allies with us. And so that we're not necessarily feeling like we're shouldering it, all alone by ourselves. But there is a lot of work that is entailed with that.
Right. Absolutely. And even as we think about resources, what are some of the mental health resources within our community throughout the province of Ontario or even throughout Canada that Black Canadians can access?
There's a lot of different community resources. There are within the East and Scarborough, if that's where you're from. I know there's Taboo and they have, a mental health component in Peel, as I mentioned. Again, if you're west of Toronto, they also have their community hub there. That is focused on mental health for Black people. There's also, sprinkles of other community centers, depending on what the need is, that can help address this. And I know, for example, City of Toronto has a really good resource on specific Black-centered resources if you're from the city. However, Black Mental Health Canada is an invaluable resource. It is interconnected throughout all Canada. I think the last check, I think we pretty much have partners almost in every province and perhaps even one of the territories. And they are well connected with some of the things that are happening on the ground in the province where you are at. Or if you're looking for a therapist, they have a directory of different therapists, some that do offer sliding scales if finances is an issue for you. And as well, they have multiple different programs, training programs for clinicians. They have actual programs for youth. They have programs for men. They have groups for women. And so, I'd really recommend going to their website, blackmentalhealth.ca. Even if it's just as a starting point. I know the team there is really centered on ensuring that, every single person who needs support can access that support. And so even if we don't have it within our repertoire, we have enough connections that we can at least try to connect you with somebody who will be able to help you as well.
Mm-hmm. And on the blog post, I'll put that link so people can go to it. So finally, if there's one takeaway that you have for our listeners, what would it be?
I would say, being a Black woman, that our mental well-being is vital to our overall well-being. I think sometimes we do look at it quite siloed, in the sense that, we have physical and then we have, our psychological health. But I would offer up that they come together, they come as a package. And so it's really important that you're creating that space and you're creating time to really attend to yourself psychologically and emotionally, just as much as you would, physically. And so, where possible, if that means seeing a therapist and kind of working through some things, then, know that that's okay. If it's connecting with your tribe and spending some time in that safe space, that's okay. And also if it's spending some time alone so you can have some time for reflection, maybe some journaling or meditation, then that's okay. But the priority here is prioritizing your mental health.
That's great. So Shanique, thank you so much for coming onto the podcast and talking about this very, very important issue of Black mental health in Canada. And for my listeners, if you want to check out Shanique, you're going to go over to shaniquevictoria.com.
Thank you so much for having me.
All right, take care. Well, this has been another episode of The Acorn. Remember, the content in these podcast episodes are for educational, informational, and entertainment purposes only. Disclaimer. Anything said in this podcast should not be considered as treatment, professional consultation, advice, clinical instruction or assessment, or any other mental health replacement. Listening to this podcast does not create a therapist-client relationship between you and the podcast host. Always seek the advice of your own mental health provider regarding any questions or concerns you may have about your mental health needs. Also, if you need immediate help, contact your mental health provider or call 911. Take care.